everyone, and welcome to Texas AHEC East AHEC Scholars Program. My name is Ashley King, and I'm the director of the Capital Region located in Austin, Texas. First, I want to congratulate each of you on being selected to the inaugural year of the AHEC Scholars Program. We're excited to have you, and we look forward to working with you for the next 2 years. This video is designed to give you a little bit of insight and a brief introduction into AHEC, as well as give you what to expect from the AHEC Scholars Program. Before we get started, I want each of you to take a minute to think about why you decided to go into healthcare. For each of you, it's going to be a different answer, but for most of us, it's because we wanted to help people. We wanted to make a difference. Some people are looking for job security, others financially, it gives them opportunities to make a better life for themselves. No one goes into healthcare because it's easy. As healthcare providers, you'll face challenges with your patients daily, trying to make the best decision for them at the time. And there are always going to be barriers to providing good patient care. AHEC understands the challenges, and we're here to help. For the past 25 years, Texas AHEC East has been working with rural and underserved populations to better prepare healthcare providers to increase access to all and promote work in primary care. Through these challenges, the AHEC Scholars Program was created. We are here to help you gain additional training and team-based clinical experiences that will better prepare you to enter practice and start solving the problems affecting your patients. To get started, I want to explain a little bit about AHEC. AHEC stands for Area Health Education Center. We were created to enhance access to high-quality, culturally competent healthcare through academic community partnerships. The goal of AHEC is to build education and training networks within communities, academic institutions, and community-based organizations. AHEC was developed by Congress in 1971 to recruit, train, and retain a health professions workforce committed to underserved populations. The AHEC network helps to bring the resources of academic medicine to address local community health needs. The strength of the AHEC network is its ability to creatively adapt national initiatives to help address local and regional health issues. Texas has 4 different program offices within the state. Texas AHEC East Program Office is based at the University of Texas Medical Branch in Galveston, Texas. There are 8 different regional offices within Texas AHEC East, and between the region, we service over 100 counties. Texas AHEC East's vision and mission were created to be simple and all-encompassing in order to be able to apply to all of our region, to the largest cities such as Houston, all the way down to our smallest towns such as Mustang. What is the AHEC Scholars Program? AHEC Scholars is a national program developed by the U.S. Health Resource and Service Administration, better known as HRSA, and state AHECs. The Texas AHEC East Scholars Program is for current health profession students interested in gaining additional training and team-based clinical experiences working in rural areas and/or with underserved populations. Every scholar will be given a statewide evaluation at the beginning of the Scholars Program. Each AHEC program has designed a didactic and experiential curriculum that will be disseminated to all scholars throughout our service region. The program will bring together like-minded students from the different programs and schools to train together on areas that HRSA feels will benefit the healthcare of rural and underserved populations. The goals of the program are to enhance healthcare knowledge in clinical and community settings, positively impact underserved communities, engage with interdisciplinary teams, gain career development skills, resume building opportunities, and networking with like-minded healthcare providers. There are a few requirements for the AHEC Scholars Program. One of those is committing to 40 hours of didactic learning each year for 2 years, as well as 40 hours of experiential learning each year for 2 years. We do ask that you commit to the full 2 years in order to be part of the AHEC Scholars Program. Concurrent credit is available through the Scholars Program. You can satisfy some of your required hours through activities you are already participating in through your school. Depending on your program, your electives and other coursework could count towards your mandatory hours. Each program and elective coursework will be different for each student, so contact your AHEC representative to coordinate your concurrent credit and see how many hours you qualify for. There are 6 core topic areas that AHEC will focus on for the AHEC Scholars Program. These topic areas are the same throughout the nation, and the modules will continue to build each year from year 1 to year 2. The core topic areas include social determinants of health, interprofessional education, behavioral health integration, cultural competency, practice transformation, and current and emerging health issues.
So IPE, or interprofessional education, is very important when it comes to healthcare. It's one of the most important aspects really when you're trying to take care of a patient. One of the bigger things that you get with IPE is that every team member gets to understand and see the role of the other healthcare provider, thus letting you understand and trust that when you're not around, your team members are taking care of your patients just the way that you would. IPE has been around for quite some time, especially in the operating room or surgery setting. There is a lot of team members that work together in order to take care of one patient. So without an anesthesiologist, a surgeon, even a clinical assistant, we would not be able to take care of our patients successfully. So it is nice to know that working closely with all these team members, that the best outcomes are usually possible. So unfortunately, the education base on IP hasn't really been caught up with the practice. So it is very important that today's healthcare provider students get an exposure to the education aspect of IPE. Up until now, mostly all the students kind of study on their own sides without communicating with the other healthcare professional students. Thus, when they actually go into workforce, they are put in a position where they have to collaborate with these healthcare providers and not really have a background, don't trust them, or whatever the other aspects are. So hopefully we can get the education aspect caught up with the real practice.
Interprofessional education will be presented throughout the program. Since the Scholars Program is designed to include a number of different health professions, most of the curriculum will teach in an IPE format. A couple of examples of the IPE didactic portion of the module are: understand the relationship between the various roles of each discipline, strategize effective communication between the healthcare team to enhance patient care, and identifying the impact of IPE. Each core topic area, along with the online module, will include an activity. An example of a type of IPE activity that you might experience would be a disaster day. These events are a great example of interprofessionals working together to improve the care of our patients. And these activities are going to be hands-on, so hopefully we can utilize what you've learned during the module and put them into action during the activity.
Kind of a big trend in medicine right now is to focus on the biopsychosocial model of health. So we're not just really looking at the person's physical health, but we're also thinking about the psychological components and also the social components. So how they're relating to their environment and relating to other people. And so when I'm in an encounter with a patient, there's things that come up where I have to realize that things that are going on underneath the surface are affecting this patient's health. One thing that I've really experienced during my time in Victoria is how Hurricane Harvey and the efforts to rebuild and to recover from that have really played into a patient's health and kind of their life. So I think that's really important to consider those things. It seems like in rural areas, primary care physicians are often the first ones who are able to interact with patients in talking about and opening up about mental health, especially in small, tight-knit communities where everyone kind of knows each other. That's kind of a safe space for patients to really open up about that. And a lot of times they come in and they kind of throw out these little hints, so they might kind of relate it to something else that's going on in their life. So I think it's really important just to listen and then to take that time and kind of stop and say, what do you mean about that? Or how is that affecting you? How is that troubling you? And you'd be surprised at how often patients are willing to talk about that and then are appreciative that you brought that up for them. One thing that I think is important is using a team-based approach. So when the patient comes in, they interact with several different providers. So they interact with the nurse and the medical assistant, and then of course with the physician. So making sure that everyone on the team is aware and is able to notice those things in a patient and kind of to help begin that conversation, I think is important. Another thing I think that as a young physician, kind of a way to break that cycle is to make sure that you're engaged with patients outside of the clinic. So whether that's being involved in community activities, being involved in sports teams, just places where you see the patients outside of the clinic and can help build those relationships.
Behavioral health is also a growing concern within our healthcare system and how to better address it. This is especially true for our underserved populations. Examples of some of the didactic curriculum for this module would be identify and assess behavioral health needs as a part of a primary care team to empower the patient, understand the link between behavioral health and physical health, as well as explore community resources and strategic partnerships. An example of a possible activity for this core topic area would be the Hearing Voices curriculum, where you actually listen to a MP3 player for about 45 minutes, which has pre-recorded voices that you listen to. During this activity, you would try to do menial tasks that normally would cause you no struggle whatsoever, but having the voices makes it more difficult. This is one of the curriculum that's used to simulate schizophrenia.
Anything we can do to cultivate having young people work in public health locally, and one of the things we're trying to do is become younger as an organization, so to plant that seed for people who may want to stay in Victoria or come back after some time. From our perspective, when we talk about the social determinants of health in public health, we're charged with making decisions that are important to the overall community, as opposed to when you see your individual physician, he's just focused on your individual health. Public health is focused on population health, and so many of the outcomes that we deal with have a lot of environmental factors associated with them. That's to say where people live, work, play, and even commute has an impact on health. So what we want our physicians locally to understand is that we have a mixed community with regards to being part urban, part rural, and those individual health outcomes are predicated on where people live. One of the things that we're working on in Victoria County is that we've pulled death certificates for the past 20 years because we want to see causes of death in certain neighborhoods, and we want to begin to break that down and looking at environmental factors such as soil content, air quality, and also schools and where people work at, because all those things impact life expectancy and the development or onset of chronic conditions. So that's really what social determinants of health is focused on. You know, what are those things going on in your community that impact your health outcomes?
Social determinants of health give healthcare workers a glimpse into their patient's reality. During this module, you will learn to describe how specific social determinants of health create and perpetuate health disparities and equity. Explain key findings related to the social determinants of health and their effect on health outcomes, as well as identify specific strategies to address social determinants of health-related inequities and disparities in a clinical setting. The activity that's associated with this that you might do as part of the program would be a poverty simulation.
So cultural competence healthcare is so crucial in today's world. Right now we are facing some major health issues that we really hope to have more culturally competent healthcare providers and even folks in the community to really talk to people in a way that they feel they are respected, and that's where cultural competence comes into play. Cultural competence care for me includes that framework that all of us instructors have had to abide by state regulations, when it comes to these core competencies of communication skills, interpersonal skills, advocacy skills, organization, teaching, service coordination, capacity building, and knowledge base. And when I think about the first one, communication skills, it's very important for us to take into consideration health literacy. We need to know how to tone the message down or tone it up, depending on what community we're trying to reach. And also, when it comes to interpersonal skills, we have to develop that trust, because trust is a real issue within not only our Latino community, but all the other minority communities that I've been working with in the past. So how do you build that trust? You really listen, and you build that relationship. You don't just come on board and just start spitting out all this stuff for them to understand. You've got to sit down and talk to them about how they are at home, what's going on at home, and then start bringing in some information about their health. When we start talking about capacity building, we found out during Harvey how important it was for our students to really know that not all cultures, and especially those with language issues, understand about prepare a plan when there's a disaster or an emergency preparedness program. It is because they don't see that as a priority in their lives. And there's, again, going back to the mistrust, there's a lot of mistrust about all these government, that you see all these government news issues that we see in the news. This is scary for a lot of people as well, because they don't trust the government and what they're saying. We found that out with Zika. There was a lot of talk about Zika in Puerto Rico, and most of the people in the island, when we interviewed our folks with our promotoras there, they said that they didn't know anybody who had Zika. So they felt that the numbers were really exaggerated in Puerto Rico. Again, government plays a role here in this mistrust issue that we're having right now within our communities. When we talk about service coordination, again, it's really how are we going to navigate people to these services that are available in their community. They've got to understand that these are available to them, some of them regardless of their race, ethnicity, or national origin. But there's no way they're going to know about that if we don't have somebody there establishing, again, that relationship, motivating them to really go out and seek some of these resources.
Cultural competence will also be a core topic area. The learning module will focus on understanding the link between culture and health practices, identifying ways to provide culturally competent care to a diverse population, as well as explain the correct utilization of interpretation or translation services. One of the activity examples for this core topic area would be Bafa Bafa, which is also another simulation, which during the simulation participants experience culture shock by traveling to and trying to interact with the culture in which the people have different values, different ways of behaving, and different ways of solving problems.
Welcome, I'm Delane Zeller. I'm an RN and I'm the Director of Cultural Development and Nursing Process for UT Health East Texas. And I'd like to welcome you today, and we're going to talk about practice transformation. And you've signed up for this program to participate in the Scholar Program, and we're very excited for you and look forward to working with you as we address the triple aim. And the triple aim is to improve practice transformation in all of our communities. And some of the goals for the practice transformation are improving the health of the populations, also improving patient and clinical team experience to include quality and satisfaction. It's very important when you're working with your teams that you understand each individual's role and that you look at it to try to maximize what you do with them so that each person is working at the top of their licensure and is able to truly anticipate the needs of the patients, anticipate the needs of the provider and the team members so that you care for the people in your community. And the third goal of the triple aim is to reduce the per capita cost of healthcare. I recently did some investigation and found out that roughly the cost of a pneumococcal vaccine is $50 to $100. The cost of hospitalization for a pneumonia patient is over $50,000. So the emphasis on preventive care can help with the costs, and that is definitely an aim through our population health and practice transformation. Healthcare is going through whitewater change right now, and we look forward to having you in our areas of the state of Texas and working with us to improve the population health of our communities.
During the practice transformation module, students will identify barriers to practice transformation in diverse or different settings, strategize ways to include the patient in the care coordination team, and explore ways to utilize resources to impact the quality of healthcare through practice transformation best practices. One example of an activity for this core topic area would be the Team Steps training. Team Steps is a teamwork system to improve institutional collaboration and communication, referring to patient safety. During the training, students will learn about assessment, planning, training, and implementation, and how to sustain it.
Hello, this is Paul McGahey. I'm a physician at UT Health Science Center in Tyler. Been here for 3 years. Prior to that time, I was a regional health department director for over 20 years. So I've been in the East Texas area a long time. And I'm going to speak about current and emerging health issues for the East Texas area. There are many. First of all, congratulations on being selected as AHEC scholars. It's a great achievement, and we look forward to working with you. I think you'll find it a very positive experience. So having lived in the East Texas area for most of my life now, 32 years, I've traveled the roads for most of that time, from the Red River down to the Houston area and parts in between. The thing that's really affecting us and impacting us are behaviors that are not the best. I'm talking about tobacco use, lack of exercise, and poor nutrition, and as a result, obesity. They lead to the three things that are really causing the most health problems and really we're dying from. That's heart disease, cancer, stroke, and lung disease, and even diabetes. Let me talk about the behaviors first, and we'll talk about those three diseases. Tobacco is our absolute #1 problem in East Texas, across the nation too, and the rest of Texas. But it is the most, the issue, if we got a handle on that, where we could prevent most of these other things from happening, at least to the excess that they're happening now. Each day, about 20% of East Texas smoke in rural areas. It's a lot more in certain populations. It's even more than that. Each cigarette takes about 11 minutes off an individual's life. And if you look across the country, the number of people who are dying from tobacco use, that's about 440,000 a year. That's equivalent to 3 jetliners full of people crashing each day. So that gives you some perspective. So tobacco use is definitely something we need to tackle. We're trying to do some things here, but we hope in partnership with you we can do more. Lack of exercise, obesity across our area, the obesity rates are higher. It couples with poor nutrition. How can we eat smarter? How can we adopt simple, healthy behaviors? How can you help us create some attractive messaging to get to individuals who are overweight? Our obesity rate is at about 35–36%. That doesn't include those who are overweight, which is another 30% or so. And that is a large percentage. That's the majority. So I haven't gotten to heart disease, cancer, stroke, but these 3 factors contribute significantly to those. If we could stem the tide with tobacco use, help more people exercise, and help people eat right, we would go a long way to a healthier East Texas.
The final core topic area will be current and emerging health issues. This module will cover identifying research and resources for current and emerging health issues, understand appropriate measures to address current and emerging health issues at the community level, as well as identify current and emerging health issues among specific underserved populations. Since this topic will constantly be changing based on the healthcare environment, the activities may vary greatly. One of those activities might be the Naxalone UT opioid awareness training, which teaches how to properly inject overdose medication. Since the AHEC Scholars Program will be offered to students throughout the service region, all regional centers will offer experiential activities for students to choose from in order to help you complete your required hours. All students will have access to our master calendar in order to find events in your area to participate in. These events will vary greatly from region to region in order to best reflect the educational experiences for each community. Just to give you an example of what type of regional activity, we have a video from Greater Houston where they're going to explain their collaboration with their local nursing program.
Hello, my name is Omar Asali. I'm a nursing student at UT Health Nursing School here in Houston, Texas. This past summer in 2018, we spent time with our community clinical with a lot of young men that are at the Fifth Ward Enrichment Institute, and we partnered with AHEC in order to work with these young men and teach them different things. And one of the main things in our class that we talked about was preventative health. There's 3 different types of prevention, and now the goal in nursing is to get many people in the community to focus on preventative medicine. So a lot of the classes that we did and planned for were revolved around that, to educate these kids, plant a seed while they're young to make better decisions, and when they're exposed to this knowledge later in the future, it won't be so foreign to them. So we talked to them about reading food labels and then having discussions following it, educating on health. For example, we did measuring blood pressure, associating it with diets, and we learned a lot. I mean, they showed us a lot, we learned a lot from them as well, because, at the end of the semester or the whole program, we recapped everything and we did a Jeopardy game. So even on the second week, some of them were even remembering my names, and it kind of drove me to invest more into them since they were investing so much into myself. And we learned a lot about them, got to know them, and what sort of stuff that they are involved in with here at AHEC, and I think it's a great place. They get the opportunity to get a lot of scholarships, whether it's through different alternatives other than what's offered at their school. And they get an incentive at the end of the year by participating, acting appropriately and learning from their mistakes, so where they wouldn't get this at another place, or they don't have another opportunity. So I felt like it was an honor to come in here and share some of my knowledge along with my classmates that we worked together with it. And I think that the goal of my course with preventative medicine, seeing a doctor before you get sick, making the right healthy choices, and working out, being prepared for a job interview, I think we kind of encapsulated that in our message with them, and I think we did a good job with them.
So my name is Leah Metter, and I was a part of the clinical group that worked with the seniors at Denver Harbor Senior Citizen Center. And so basically what we did was we went in and we gave educational classes to them just about different health promotion things, like nutrition, exercise, and things along those lines. That there are many different types of people that are there that care about what you have to say. And so it was really fun getting to work with them and getting to interact with them. So my expectations when I went in were the first day that we were there, they kind of made it clear to us that our time there was very short because we were cutting into their bingo time. And so they, kind of told us up front, hey, you need to make sure that, what you're doing here counts, because we could be playing bingo. And so kind of catering to their needs and what they wanted. While we were there, we made an exercise bingo. We made a nutrition bingo. So we kind of listened to what they had to say and what they wanted from us, and made our health education fun and exciting for them. So I was in Miss Peterson's Wednesday clinical group.
I was part of her Tuesday group.
And we had a really, really great time working with AHEC. They provided so many resources for us, and we really hope that you have the same experience that we did.
Most definitely, yeah, it was a great experience, and I hope that you can share it as well.
Scholars can also submit a request for a student-selected experience. This might include a conference you are attending or an extracurricular event with your school that directly relates to one of the core topic areas. These hours can help with your experiential and meeting your 40-hour requirement. The AHEC Scholars Program will be utilizing course sites to upload all didactic modules for the program, as well as access to the calendar function for Scholars events. Course Sites is a Blackboard platform, so many of you should be familiar with the functionality. We're going to do a quick tutorial just so you guys have a quick introduction on how to get started with the course sites. Unfortunately, there are two course sites currently. They have the original course sites and the new course sites. The Scholars Program will be utilizing the new version, so make sure when you go to sign up, you select the new platform. AHEC will send you an email to invite you to be a part of the course sites. When you go to sign up, just make sure that you use the same email that you used to sign up for AHEC Scholars, because that's where we're going to be sending the invitation to. Once you sign up for the program, you will receive a verification email from Course Sites. You should not have any problems creating a username or password at that point, and once you've done that, you should be able to log on to Course Sites. If you have any trouble opening your account, try clearing the cookies for the website, and then it should work properly. If any of you are not familiar with Blackboard or Course Sites for that matter and want a little bit more information, there are several tutorials online that you can go and look at that'll better explain the site and how to utilize it. Or, as always, you can always contact your AHEC representative or the program office to learn more.
Welcome. My name is Dr. Kaylee Satterfield, and I am the Director of Texas AHEC East. I would like to take this opportunity to congratulate you on your acceptance to the AHEC Scholars Program. AHEC is proud to offer you the opportunity to participate in the inaugural year of our AHEC Scholars Program. This program will draw a multi-profession cohort of students, not only from UTMB, but also from other institutions in the broader Texas AHEC East region. At its core, AHEC Scholars is a recruitment tool. Our goal is to find dedicated health profession students who want to work in underserved and rural areas. The AHEC Scholars curriculum will broaden your knowledge of healthcare and give you the knowledge and skills necessary to work with diverse patient populations and health issues. We realize that being an AHEC Scholar requires additional coursework and activities on top of your already heavy workload. We have carefully selected didactic and experiential activities that will enhance your knowledge and skill set. Through community service learning activities, you will build rapport and relationships with fellow students, preceptors, and members of the communities in which you serve. Throughout your experience, AHEC staff will be there to support you. I encourage you to utilize the AHEC staff and their resources in the communities they serve. I want to thank you for your commitment to underserved and rural populations through your participation in AHEC Scholars. I encourage you to provide feedback about your experiences. AHEC is dedicated to improving the Scholars Program every year and building on the experiences you find valuable. I look forward to working with you over the next 2 years.